All right, good afternoon, everyone. My name is Sean McMahon, and I'm the Program Manager for the Lister Hill Center for Health Policy. I'm very excited to welcome you to today's webinar, My Right to Live, Rights in Reporting in Long-Term Care. We have three guests joining us for today's webinar. First, we have Ms. Sheree Head. She is the Long-Term Care Ombudsman Coordinator for Jefferson County. In this role, Ms. Head serves more than 6,000 residents in long-term care facilities across Jefferson County, advocating for residents and investigating allegations of abuse or rights violations for any resident in long-term care. She also helps to settle disputes between residents, administrators, and family members. Ms. Head has served in this role for the past 3 years and was previously a child abuse investigator for the state of Alabama. Ms. Head has spent her career advocating and fighting for the voices of the vulnerable to be heard and to be uplifted. She's also a UAB graduate, so go Blazers. Moderating today's discussion are two students, Ala Abus-Batani and Sarah Van Winkle. Ala and Sarah are both participants in the Lister Hill Center's Health Policy Ambassadors Program, which pairs interdisciplinary student teams with community partners to identify and address policy issues. They are working this semester with Ms. Head to improve residents' knowledge of the Ombudsman Program, as well as the reporting process itself. And with that, Ms. Head, I will let you get started.
I appreciate the opportunity to speak with you all on today and kind of give you an overview of what it is that I do on a daily basis, what has been my passion for the last 3 years. That I did not know much about this area before I came to this position, but it has definitely become my passion. And so if I get a little bit excited about some of the things that I talk about, please forgive me. It's just, this is my baby and this is what I do. And I appreciate the opportunity to be with you guys. So I'm going to put my slideshow up and kind of give you guys some information about the Ombudsman program. So we're going to start with a couple of things and understanding. I want you to understand what residents' rights are in long-term care and kind of what it is that we do. So if we'll take a look at a couple of things. First thing we'll talk about is, what is an ombudsman? An ombudsman is a weird word that people often get wrong. I don't get offended. I get variations on it all the time. It's okay, as long as you know to call me, I'm okay with that. But the ombudsman is a Swedish term that literally means one who speaks on the behalf of others. So, or as it says, a go-between or an advocate. That is what I do. I'm an advocate for residents in long-term care. There are many types of ombudsmen in different industries and different areas, in different settings, but I am a long-term care ombudsman. So I advocate for the rights of individuals that are in long-term care. Sometimes I have people that are called that are from different areas, especially industry workers, or they'll call and I was like, that's not exactly what I do. You have to be in long-term care to access our services. So like this says, in this instance, an ombudsman is an advocate for residents of long-term care facilities, which includes nursing homes, boarding homes, and specialty and assisted living facilities. I specifically work with Jefferson County. So I only monitor the facilities in Jefferson County. I will tell you that in Jefferson County, there are 34 nursing homes in Jefferson County, 32 assisted living facilities, and 45 boarding homes that we monitor. So that's about 112 facilities that we monitor on a regular basis. So it is a lot, but it's definitely needed. And so we're actually, there are 3 ombudsmen who work. I'm the coordinator for the program, but there are 3 of us that work to cover the entire county and make sure that we're responsive to any resident. As Sean stated previously, there are about 6,000 individuals in long-term care across Jefferson County. And so on any given, you be responsive to them. So like it says, ombudsmen work to protect the health and safety and welfare and rights of residents in long-term care. So one of the things to get more in depth about what it is that we do. Exactly. So we do work to investigate and resolve complaints. Anybody in the county, anywhere, doesn't have to be in the county, anybody anywhere can call and make a complaint regarding a nursing home or an assisted living or a boarding home. If they have concerns about something that's happening inside of those facilities, they can contact us and we'll investigate those concerns. I will, to be very transparent, I think a lot of times we get calls from former employees, people who no longer work in the facility. And I will say those are probably a little bit more frustrating because they're only willing to tell the issues that are going on in the facility after they are no longer employed there. And so I will say that the advocate in me is bothered by that because you knew this was going on months ago, but you didn't say anything. So I am bothered by that, but it doesn't mean that it's not true, regardless of their motive for making that call. It doesn't matter. We still investigate it. We look into it. And if it's true, it's true. And if it's not, it's not. And so we try to make things better for those residents, regardless of the reason why people are telling us. So as I stated, we looked into nursing homes, assisted living, specialty care, assisted livings, which may be something like a memory care for individuals that have dementia or Alzheimer's, and boarding care homes, which are boarding homes. Jefferson County is the only county that actually monitors boarding homes. No one else in the state does that. So we're working through that and finding ways, and we continually find things that we need to work on regarding our boarding homes, because we are charting a new path, and that is uncharted waters for a lot of us. So we're working, and so we're really trying to strengthen that, and we do that by strengthening our relationship with the health department, who also oversees boarding homes. And so we try to build community partnerships with other agencies that can assist us and help us in making sure that residents, and even in boarding homes, are cared for properly. Like, again, we ensure that residents receive quality care that they are entitled to. We also act as a mediator. That's a lot of what we do, is mediation between family members and residents, or that's between the family and the facility, or could be all three, whichever way that comes. But what our job is, we work to the satisfaction of the resident. So regardless of who calls us, it could be a family member who calls and says, I've got issues with some things going on in the facility regarding my mother. We can look into it, but if mom doesn't have an issue with it, then we resolve it to her satisfaction, regardless of what the family member or anybody else says. So the mother might say, I don't have a problem with that. I don't want to go to activities. And that's perfectly her right to say so. And so we can't do anything unless the resident has an issue or concern with it, regardless of who brought it to our attention. And that also means, and for a lot of social workers who enter into this field, it's very complicated and tough because we are not mandatory reporters, as most social workers are. And so most people in healthcare are mandatory reporters. We are not mandatory reporters in the sense that if the resident does not want us to report something or look into something, we cannot do it. So that kind of stops that train. So it could be as serious as abuse, as them being harmed, all the way to something very minor. But if that person says, I don't want you to look into it, we're not able to investigate that complaint. What we will try to do is check in on that resident a few times, especially if it's something as severe as abuse, to make sure that they feel protected. And sometimes it's just a matter of building that relationship with the individual until they feel secure and safe in giving us the information that we need to be able to look into things for them. So sometimes we just have to work a little longer and help build that trust to be able to, so that they know that something is going to happen and they're not going to be retaliated against because they said something. So the other thing we do, which is what I'm doing today, is we educate residents, families, facilities, and the public about residents' rights and about the Ombudsman program. So I do a lot of speaking on behalf of the program to different agencies in different areas. We also do in-services. We can go inside a facility and work with the facility, work with the staff if there are concerns, if there's areas where things are not going as they should be. We can go in and do in-services with the staff to train them and work with them on the areas that are deficient within the facility, so that we make sure that we try to do that in an attempt to make life better for our residents in long-term care. We provide information to the public through community educations, which is what we're doing today, and through phone calls for information and assistance. We get several calls on a regular basis from individuals in the community, especially when you have individuals who are preparing to put someone into long-term care. In most cases, that comes suddenly. In a lot of cases, that comes suddenly for people, and it's not something that they prepared for or thought about. They had a loved one who was perfectly fine doing their own thing, living in their own home, and then they had a stroke, and now they're paralyzed on one side, or they're no longer able to talk or able to care for themselves, and suddenly you need long-term care. And they don't know where to turn to find that information, to get an understanding of the facilities and what's out there and what's available to them. So one of the things that we do is we provide information and assistance to individuals who want more information about long-term care, about the process of how to get into a nursing home, Medicaid applications, the difference between Medicare and Medicaid, and which one pays for care and which one doesn't, and all those sorts of things. And so we help them, kind of guide them through some of those steps. As an ombudsman, although I'm inside of those facilities on a regular basis, I cannot give my personal opinion about any facility, but I can and do give people information about the things that I've investigated inside of that facility. So that is open for information for the public. You can't necessarily request our records, but I can tell you if I've been to this facility because I've investigated 3 times in the last 6 months about residents falling or being harmed or whatever those things are that I've investigated. So I'm open and honest with them about the different things that I've looked into those facilities, but never give my own personal opinion about a facility. We represent residents' interests before state and federal government. I just yesterday mailed a letter off to President Biden. That was actually a thank you letter as a follow-up to of some letters that we had submitted previously advocating for the changes that they have just made in long-term care. And they've had an extensive overhaul in making sure that their residents in long-term care who were severely affected by the COVID pandemic, as you all most know, that they were the first and hardest to get hit when the pandemic first came to the United States, and we lost many, many residents in long-term care. And it really just opened up Pandora's box of all the issues that were already going on in long-term care and things that needed to be addressed long before this. But the pandemic just kind of put a light on it and made it even greater. And it kind of, it just exponentially grew those concerns and those issues. And so the Biden administration has done a really good job of finishing up some of the things that the Trump administration had started. And they added a lot more things to it to get some legislation passed that would protect residents in long-term care. So we submit information and things, and we'll lobby for different things for our residents in long-term care. So we work from the federal level all the way to the state level and the local level to try to get things changed and make some change for residents in long-term care. And like I said, we monitor upcoming legislation, anything that may be coming up. So I was excited to be able to send that thank you for legislation that's been passed, and we're still pushing for some things. And so we keep an eye on those things as well, and keep in close contact with CMS as well, which is one of the governing bodies for long-term care facilities. So one of the things we'll talk about really quickly is rights of residents in long-term care. The biggest thing with our residents in long-term care that we really push for, that's the voice that we are there to be for them, is about their rights. They don't know that they have rights in long-term care. They are very hesitant about pushing things because they feel like I'm a part of this big machine and I just have to go along to get along. And they don't recognize that they actually do have rights in long-term care that are afforded to them by the Older Americans Act of 1965. That act gives them rights while they're in long-term care. And those are the things that we govern when we go inside a facility. And anytime these rights are violated, we work with the facility to make those things better or to change some things, take action against those things that are happening to them. One of the things is they have the right to be treated with dignity and respect. You're dealing with individuals who are 70, 80, 90 years old. Even I have some residents that are over 100. They have lived a long, healthy, wonderful life that requires respect, and to be able to not only see them as the 88-year-old that they are now, but also the 38-year-old that they were when they were pilots, and when they were doing other things, and when they had a family to take care of, and all the things and all the accomplishments and things that they did over their life, those things don't go away just because they're in long-term care. They still have the right to that dignity and respect and to be treated fairly. One of my biggest pet peeves is when people, when they baby talk to residents in long-term care. And it's like, oh, are you wet? Oh, okay. Oh, we'll change you. That sort of thing. They are not babies. These are not babies. I don't even call them diapers in long-term care. They are adult briefs. Change their brief. But it's that talking down to individuals and diminishing who they are. And it makes them feel vulnerable, and it makes them feel unsafe. And, because I have to depend on these people to do everything for me. And when they put me in a position where I feel like I'm a child, they're more likely to act out in that manner. So we want to make sure that they feel that they're being respected, that they have the dignity. And dignity also includes closing the curtain when they are being changed and things of that nature, and not just exposing them just because this is something you do 20 times a day. They still deserve dignity, even in the way that you care for them and respect their privacy. To be free from chemical and physical restraint. At no time should you walk into a facility and see a resident tied to a bed, restrained in any way. Most facilities don't even have the bed rails up on the beds because that is still considered a form of restraint as well. So it's kind of weird because it's almost as if the resident has the right to fall. So they don't put the bed rails up, because if they want to roll out of the bed, they have their right to do so. If they want to get up whenever they feel like it, they have the right to do so. So those bed rails are considered restraints in some cases to prevent them from getting out of the bed. And so residents should not ever be tied to a bed in any manner, or made to stay in a bed in any manner, or chemically restrained, which means that they are over-medicating individuals to keep them quiet and keep them asleep so that they don't wander around or they don't cause a disturbance. We are very leery about individuals who are always heavily medicated and can't ever communicate with you, which when they should be able to. So that's always a concern of ours that we look for. The ability to voice grievances without fear of retaliation. That's a major one, and that's a big barrier for us, is that people feel like they won't say anything because, again, we're only in those facilities once every 2 or 3 months, and we leave them there with those people who are tasked to take care of them, who may also be mistreating them. And so they want to say something, but they're fearful because if I do, then what happens? Then what happens when you leave and they're still here to take care of me? And so they're very fearful of that. And so we have to, like I said, gain their trust and work with them. And I'm very big on, even, I don't care if it's as much as a staff member going back to a resident and saying, why'd you tell them I hit you? I didn't hit you. I didn't mean to hurt you. Or in no manner should they go back and say anything to their resident because they said something. But sometimes they'll go back and go, well, you didn't, it wasn't that I didn't push you down, you lost your balance. So trying to influence them in any way. So we try to work very hard to make sure that that individual is no longer caring for that resident, that they're moved to another space, but that worker is moved into another space. And so that person can feel secure in their home, because this is their home. And like a lot of our family members say, I had one family member say once that this is my mother's last home, and I want it to be safe and I want her to be happy in her last home. And that is the case for most of our residents. So I want to make sure no one wants to be fearful of anyone that lives in their home, whether they're paid to be there or not. And so we work very hard to try to make sure that when that individual's personal life or personal well-being crosses someone else's professional life, that those things are handled with care and with dignity and respect and those sorts of things, and they understand the difference in the two. Sometimes I call it staff members being professional family, almost. I want you to love them as if they were your family member, but I want you to do your job in a manner that is professional and dignified in the way that you care for them. Associate and communicate privately with anyone of their choice. Residents have the right to have private phone calls, to have visits privately. Most residents in long-term care share a room with another individual because Medicaid will only pay for that, which is, I'm excited because that's one of the changes that was made in this last round of legislation, that individuals no longer will have to share a room. necessarily based on their Medicaid standing, so that individuals can have more privacy in long-term care. So they have the right to have private conversations and private meetings and see people individually. That right goes all the way from being able to make a phone call in private, all the way to being able to be intimate with someone if they choose to, in their room or in a space, that they can do that privately and still have that contact with individuals in whatever manner they choose. If they just want to snuggle, they want to cuddle, if they want to have intercourse in whichever term, whichever way they choose, they call intercourse. They have the right to do that. They just can't do that with another person in the room, with their roommate in the room. So residents who share a room have to request a private space from the facility to be able to do that. Whether that's, I want the private dining room so me and my family or me and my husband can have dinner by ourselves, or I need another room with a bed so that we can do whatever we choose to do as adults. So they have that right. And I'm like, I am all for it. Yes, ma'am, do what you do. It is so okay. That, again, their lives don't stop. They did not become this, shell of a person just because they're now 85 or 75. And one of the things that we have to recognize also is that the demographics of long-term care has changed greatly in the last 15, 20 years. We've got individuals who are 30 years old, who may have been involved in a car accident and they're now paralyzed and they need long-term care, or they were involved in some illegal activities and got harmed and they're now in long-term care because, as I say all the time, most gangs don't have, they don't have AFLAC. They don't have a plan for individuals once they've been injured in whatever it is that they were doing. And those individuals end up in long-term care just alongside the 75-year-old man who now needs that type of care. They're all in there together. And so those desires, the desire for the 35-year-old who's in there who may want to be intimate is no different than the desire that the 75-year-old man might have. And they all have the right to do that. So that is one of the things that's always a big hang up for some of our facilities. And we also, like I told you, we do in-services with staff. And that was one of the things we had to go in and create an in-service and go in and express and explain to them and work with them about individuals in long-term care, their right to sexual expression. So we have in-services that range for any instance that's going on inside of long-term care. So one of the other things they have the right to is send and receive their own personal mail. Just as you go to your mailbox and get your mail out and nobody's opened it, it's the same way for them as well. Nobody should open their mail unless there is a concern that there is some danger involved or something that's not quite right going on, if they're receiving something that they shouldn't be. I had one facility where the individual was receiving parts to build a gun, to make a gun. And the facility, when they would see the boxes come, it was like Urban Outfitters, they thought it was closed. And so they were like, okay, we're taking the boxes. And so they were paying attention until after a couple of shipments and he had gotten the scope and gotten walkie-talkies, and I'm not sure exactly what he was going to do with all of those things, but they had to stop and go, hold on, we need to check these boxes before we just give them to him, because you cannot build a gun in long-term care. So unless there's some danger, something that you see that may not be okay, other than that, that individual should be able to open their own mail. Now, you can take that mail to them and say, hey, we've got some concerns. Can you open that while I'm standing here? So they're the ones that open it, but you can still see what's in it to make sure that it's not something that they shouldn't have. So have personal and medical records kept confidential. A lot of times that goes out of the window when you're talking about care between different staff members. They may come down the hall and they'll just kind of throw out, Mr. Jones' catheter came out again, we got to put it back. But they're attempting to care for him, but the rest of the hall doesn't need to know that, one, Mr. Jones has a catheter, and two, that it came out. Nobody needs to know that. And so we work really hard with them trying to make sure that they understand that, and that there are all kinds of ways to mishandle people's medical information. Not just, I left a chart on the table. There are all sorts of ways to mishandle that. And so we try to be vigilant in that area too, and that they feel that those conversations are being kept private for their sake. They have the right to be fully informed prior to being moved. They have the right to be informed about any charges on that they will incur in the facility, whether they're paying it or not. It doesn't matter who's paying the bill. They have the right to know what's being charged to them. We had one individual who called because her dad had been getting charged for podiatry appointments for the last 6 months at about, I think it was like $140 a month for podiatry appointments, and he didn't even have any feet. So it's like, how is that? Like, what is podiatry doing for him? So he had both of his legs amputated prior to coming to the facility. So why is he being charged podiatry appointments? But those are just things. And so they have to be vigilant about looking at what's being charged to them. And so we will go back and not fight necessarily, but work with the facility to get those charges taken off and to change those things and make sure that either they're getting the services that you say you're charging them for, or to make sure that those things that are being charged are actually things and services that the resident actually needs. And I'll end that on, we'll stop there with these slides, but one of the things I did want to look at is what to look for in long-term care. When you have individuals who are going into long-term care, there are some things that you want to be mindful of when placing a loved one there. Are their residents' rights visible? We take great care to make sure their rights are posted. Their residents have a copy of their rights in their rooms, that they're posted around the facility. Look to see if those things are posted for residents to see. And a lot of times they have these big posters with this itty bitty writing on it that nobody can see, that I have to get close up on to see. So residents can't see that. So we want to make sure that those things are visible, so that the facility doesn't have any qualms about making sure residents know what their rights are. Check the atmosphere, the communication. How is the staff communicating with the residents? How do the residents respond to staff? If there are people that they just kind of roll by and act like they don't want to speak to, look into that. Look at those things. So make sure that you're paying attention to the interaction between the staff. That's one of the things that we do a lot of, is looking at that when we walk into a facility. All of our visits are unannounced, so the facility never knows that we're coming. And so we do that so that we can get a really good picture of what is actually going on in this facility and how things run on a daily basis for them. And so we can come down the hall, and if I don't see any staff, or I may see 8 CNAs who are all huddled at the end of the hall talking. Well, it's great that you got enough staff here, but they're not engaged with the residents. I should not walk through an entire facility and not see one person working with a resident. That is the purpose. That's why you're there. So everybody can't be busy doing other things, because then who's attending to our residents? Check the fees, like we just talked about. Check and see what they're charging individuals for, and to make sure that those things are actually in place. Read your contracts. Look at that thoroughly to know exactly what you're assigning that individual up for. Because most times it's not the individual, the resident, who is signing themselves or admitting themselves into a facility. It's a family member that's doing that for them. So please know what you're getting that resident into and what this facility's goals are, what their guidelines are, because you're going to leave that person there, and they're going to be the ones that have to experience all of those things that you need to know about before you even put them there. Food, what type of meals do they serve? Is there a variety to it? When are meals being served? That sort of thing. If there's the menu posted, are they actually getting what's on that menu? Are they serving them what's on that menu, or is it just there for show? Because it sounds like a good menu, but they're actually getting sandwiches every day. You need to know that. Safety, if there's like any safety hazards that you might see when you're in the facility, look at those things, what their care is, how they administer care to their residents, all those sorts of things. Activities, what kind of activities do they have? I will go in and read the activities board. And I had to tell one facility recently, I was like, oh, looks like y'all got some great activities. And I was like, oh, there's Jeopardy, and y'all do Wheel of Fortune. And, and the resident said, no, we just watch it on TV. And I was like, what? I was like, and they were like, nobody goes to those activities, because we want to watch Wheel of Fortune. We watch it in our room. Like, we don't have to have a group setting just to watch Wheel of Fortune. Like, I'm like, so they're not actually playing it with you? No, it's watching it on TV. And then there's a news hour, where they get together in the morning and watch the news. Again, none of those activities should be centered around watching television unless it's a movie night or something of that nature. But making sure there's a variety, because they'll put things on there and you'll go, oh, that's nice, they're doing Jeopardy. And that's not really what's happening. What's in jeopardy is residents' social abilities, not actual jeopardy. So, but we look at those things. So we go in and we look at the menus, we look at the activities, we check call lights to see if residents have been sitting waiting for long periods of time with lights blinking and nobody's responding to them. So you want to check all those things when you walk into a facility to make sure that the residents are well cared for and that the facility is responsive to the residents' needs. So that is kind of my overview about long-term care ombudsman program. So do you guys have any questions or anything regarding what have we gone over so far?
So just to make everybody aware, there is a Q&A option for the webinar, and you can go ahead and leave your questions in the Q&A. But I guess, Ms. Head, thank you again for taking time out of your day to just come inform us about residents' rights and how the Ombudsman program works. I think it touches the lives of a lot of people, even in this webinar, who are watching today. So thank you for that.
No
and
problem.
we had a couple of questions, perhaps just to clear a couple things up. One of them being, what kind of led you down this path? What started your career in the Ombudsman program, and ultimately, just what led you to get involved with this program?
I will say, as a UAB grad, when I came out of UAB, I was intent on going to law school. I was like, I'm going to be a lawyer. I'm going to change the world, one case at a time. And I quickly realized that not so much. I don't think it's not necessarily for me. What I liked about law was the advocacy part, for advocating for individuals and speaking on their behalf. That's what I liked about law to begin with. And so I found that I could do that in a different setting, in a different way. Initially, when I began advocating for individuals, I started doing that through DHR when I was working as a child abuse investigator and then a supervisor. I was there for about 10 years doing that. And I really loved, I was a severe abuse worker. So I saw the worst of the worst. And you name it, I have sat across the table from individuals that I know 2 hours ago, you just killed your child. I've had to interview those individuals. I've had to talk through that. I've been to the coroner's office to see children and all those sorts of things in the hospital with them when they turn the machines off. I've seen all of that. And it was a lot. And so I did enjoy advocating and fighting for kids who don't have a voice for themselves. But I will say that kind of work is very, very tough, and it takes a toll on you after a while. And so I knew I still wanted to advocate for individuals, but I had reached a place that it needed to be in a different way. And surprisingly, moving into advocating for seniors, it's a lot of the same skills that I used when I was doing it in child welfare, because the same fears that children have about saying, mama hit me or daddy touched me, are the same fears, the same way that older Americans fear who are in long-term care, because I'm going to leave you there with your abuser if you don't find that something happened. And so they're afraid to tell you. And so I had to use a lot of those skills that I had to use to get children to tell me and to talk to me about things, and gaining their trust to talk to me about things that were happening to them in their home is the same thing I do when I talk with residents in long-term care. What's happening in your home? What's happening to you? Are they taking good care of you? What's lacking here? And so it's some of the same things, and I can advocate in the same ways, and some of the same things that happen to them. A staff member may hit them, or there have been instances of sexual abuse in long-term care and different things. And so it's a lot of the same things. It's just done for a different population that are just as vulnerable as the children that I served for 10 years in Jefferson County. So it makes a difference. And I really do appreciate the differences with older Americans is that I can move them better into being able to advocate for themselves. I can give them the tools to help them become self-advocates and move them towards that and being able to feel comfortable and confident in speaking for themselves. So you don't always get to do that with children, or that's a very long path that takes to get them to understand that it's okay if you say something, because their whole life changes because they said something. And so it's very hard to convince them that, yes, this was the right thing to do. For older Americans, they can see the benefit of it. And as we walk alongside them, we can get them into that place of self-advocacy. And I have residents that I started out completely advocating for, and they didn't even want me to use their name. So now they'll call me and say, hey, I had this issue in the facility and I went to administration and this is what happened and we changed this. And so you can see that growth a whole lot better and them being able to advocate for themselves. And that's what I really appreciate and gravitated to in coming over to the ombudsman world.
Thank you. We have a few questions in the chat that we can go ahead and address. The first one that came in, the first one says, what is the relationship to the independent living movement?
We don't do much with independent living. We don't oversee, we don't monitor independent living facilities because they have the right to come and go as they please. And so there's not as much restriction. But we do try to push our residents who are in long-term care to become more independent and to try to move towards that if that's possible. We have a program called the Gateway to Community Living program that is through Medicaid that we market when we're in the facilities to individuals who are in long-term care, that you don't have to stay in long-term care, that if there are barriers to you being able to live in the community and live independently, that program helps them move towards that. And so they can, if there are things like your home isn't retrofitted for you to be able to have a wheelchair to live in your own house, they will install handlebars, things of that nature. They'll install ramps and things to get you back into your home, to get you more independent. But as far as us working with independent living facilities, we don't generally work with those, even though they may sometimes be on the same campus with the assisted living and the nursing home, we don't monitor those.
Thank you. Kind of going on that same vein of the independent living movement, there is something called the Community Waiver Program for people with disabilities that seems to have been hosted recently, an event here. So can you perhaps comment your perspective on that situation in Alabama?
I will say I haven't really gotten into that a lot. What I've found is that there needs to be more talk about independent living and about individuals living independently and being able to maintain on their own. There definitely needs to be more around that, and there definitely needs to be more waiver programs that assist individuals in being able to stay independent as long as possible. I do, when I have individuals who will call about their loved one needing to go into long-term care, I give them several other options before we get to that, to say, there are ways for them to continue to stay in the home. One of the options that we give them is there's a program here within the AAA that I work with, that I'm under. We run the senior nutrition program for individuals who go to senior centers every day. So if it's a situation where your mom just doesn't need to necessarily be at home by themselves all day, but they can still kind of care for themselves in some way, senior centers are a great option for them to go and be able to interact with other seniors, to still maintain some of that level of independence and be able to, talk with other people, do activities, and their contracts with Class Train and other companies that will pick them up from home, take them to the senior center. And our program runs the food nutrition portion of that, where they receive meals, they eat while they're there, and they can take things home with them as well. And then they return them back home at around 3 o'clock in the afternoon or so. And so the individual doesn't have to worry that my mom is at home by herself. Did she eat all day? Or did she fall and nobody knows it yet? Or those sorts of things, that she can get that interaction, and that the family, the caregivers, or whomever can feel secure and that they're not at home alone and there are other eyes to watch them, and it works out better. And then if you need a sitter, then you only need it from like 4 to 6 until you get home, rather than trying to pay a sitter all day long and trying to cut that cost. So we do give them other options on different ways to try to help individuals maintain their independence as long as possible.
Kind of going back to something that you had said earlier in your presentation, mentioning, like 35-year-old resident versus like a 73-year-old resident. How do you make sure that everyone's rights are implemented equally to maintain their dignity with their individual needs?
You really have to listen to their resident individually. A lot of what we do is trying to individualize care in long-term care, and again, not thinking that this just is some machine that they have to go along with. That it really is personal. It's personalized care. It's individualized in the sense that what my care needs are and what I need. It's absolutely okay for me to express that individually, although it may not even be what my roommate in the same room with me needs. And because like I went into a room yesterday, he was I think about 32, and his roommate was I think 67. And like I said, do they need different things? Do they want different things? Absolutely. But do they get along well? They do. But I individually, he told me some issues that he was having, and the other gentleman told me some issues that he was having. They're completely different, but I'll address those individually for those individuals to make sure that they understand that these are my rights, not just necessarily overarching rights, that they express their own individual rights.
Thank you. So we have another pretty interesting question. So one of the guests was talking about how they were doing something with an organization before where they were working with people in nursing homes, and then they would learn that their car or what their car looks like, and then word would get around in that nursing home that, hey, this person is here. And it might, I guess, occlude having a true picture of what's going on in the nursing home if everybody's on high alert that somebody's coming. So how do you kind of access the different buildings in different ways, or what do you kind of do to prevent something like that from happening?
There's really no way that you can, especially for us, because every facility in Jefferson County has posters hanging, it should be throughout the facility, but at least 1 to 2 in every facility that has my picture and my phone number on it. So you know who the ombudsman is. It's twofold. It works against you sometimes, but it also helps because the residents, they pass by their poster often and they see my face and they recognize who I am. And so they know who I am when I enter a facility, but also staff knows who I am. And like, I can go into a facility and most times, like I said, we go unannounced. So the residents nor the facility ever knows that we're coming. And so we can probably get about a third of the way through a facility before somebody recognizes, oh, you're the ombudsman. Like I literally had a lady one day, my poster was behind her. She was sitting in the nurse's station. My poster was hanging right behind her. And she kept going, you look so familiar. And I was like, oh, okay, really? Yeah. And so I didn't say anything because I actually had to come back later because they were having a very inappropriate conversation. And right at the nursing station, they had to come back and say, hey, y'all might need to stop that, and point in my picture. So a lot of times they don't recognize you right off. And I appreciate that because like I said, I still get to get a feel for what actually is going on and how people are being treated. But there isn't a whole lot of ways to combat that. Once they know you're coming, unless you got several different cars you can drive and show up different times, different days. That's the best thing I can tell you to do is show up at different times and different days because the shift, the workers are different. So if you visited this week, during first shift, then next week, try to go on second shift or try to go on the weekends because those are different staff members. And so they won't readily recognize you. Now the residents, especially if you're good to them, they are excited to see you coming. So they may spread the word, but consider that a good thing. Don't look at that in a bad way.
We had another question in the chat asking if there is a public listing of nursing homes and long-term care facilities that list allegations of abuse or proven cases of abuse. And if there is one, where can it be found?
Yeah, Alabama Department of Public Health, ADPH has on their website, they keep a listing of all the facilities all over the state. And they also keep a listing of anytime they go in to investigate a facility, they keep those things are listed on their website as well. So if you check out Alabama Department of Public Health, those things are listed. There are also 5-star rating through CMS, which is the Center for Medicare and Medicaid Services. They have a rating system for facilities as well that you can go and look at. But that rating system is changing some, because there are some facilities that I go into on a regular basis that might have a 5-star rating, and I honestly can't tell you how. But so be careful again. So that's why you want to look at the facilities for yourself and kind of go through them and see if they meet your needs and what that is, because just because they had a 5-star rating, and they could have had a 5-star rating from their things 2 years ago, that they had to, that during their survey 2 years ago, that they may have gotten that rating. And since then it has completely changed and they just haven't been surveyed again yet. And so you just want to make sure that you're looking at the most up-to-date information. And that was the best way, is to actually check out those facilities. I had someone ask me one day, do you look at Google reviews? Like, they was like, why don't you go to the Google reviews? And then wanted me to go and investigate everything that people put in a Google review. And I was like, I don't know about that, because some things are one-sided, and it may not be exactly what people or their experience in the facility. It may not be what everybody else has experienced. And so you kind of want to weigh those things and look at it objectively. But ADPH and CMS both have sites where you can go in and look, and it'll tell you how many beds are available in that facility, and all the information that you would need, as well as on their last surveys, if they've gone out to investigate a complaint, those things are listed, and any fines or any penalties or deficiencies that that facility might have is listed on ADPH's website.
So you did mention in your presentation, I mean, you kind of oversee all of Jefferson County. You've got 112 facilities you have to look after. So we were wondering, how does the volunteer program kind of supplement what you guys do, and what are their responsibilities, and how could somebody even watching this webinar get involved in helping you all out?
Oh, that's wonderful. We always need volunteers. I will say recently it's been kind of tough with our volunteers because of the pandemic. We haven't been able to go into facilities, and so we also haven't given our volunteers permission to go inside of facilities yet. So one of the things we started during the pandemic was, well, it's before the pandemic, but we really tried to ramp it up during the pandemic, was the pen pal program, where you write to residents in long-term care, and you can stay in communication with them through written communication. So we worked on that, trying to up that a lot. That's one of the ways you can volunteer, is through the pen pal program. You can be an ombudsman volunteer, where you do go into the facilities, and we are just now getting to the place where we're allowing them to go back in. So I had kind of paused on training our volunteers until we were able to do that, because it wasn't a lot that they could do, and it tends to frustrate people who really want to get in and help, and they're just kind of sitting on hold. So I am opening that back up to start training our volunteers. There is a training process that you have to be trained to be a ombudsman volunteer. Ombudsman volunteers do not investigate concerns. They are friendly visitors, is what we call them, and they go into the facilities on a regular basis and just see what's going on and keep eyes in the facility, because like you said, we have 112. We can't be everywhere all the time. And so to keep a presence inside of the facility, our friendly visitors will go in and they help build those relationships with individuals in the facility, and they trust them. And a lot of times our volunteers will come back and say, hey, Miss such and such is having an issue. And they'll tell them before they may tell us, because they're more familiar with those friendly visitors. And so we're absolutely okay with that. And they bring that information back to us and we investigate it. But anytime, like I said, if you want to do that as a volunteer, working inside the facility, or as a pen pal, and we're also starting a phone a friend program where you can talk over the phone. You can contact residents over the phone and talk and kind of communicate with them that way. So we try to have different levels for people's comfort level and how much they want to share and how intimate they want to be with individuals.
Thank you so much for all that information. We do have one other question. I know we're coming up to the end of time, but if you could answer this question really quickly. How can you advocate for someone who needs long-term care, but for some reason, no facility is accepting them?
It depends on what the facility's reasons are for not accepting them. Sometimes the hardest population we have to place are individuals who have been previous sex offenders, who may be on the sex offender registry, and they do need long-term care, but most facilities don't want to accept them. So it's very hard to get them placed somewhere. So trying to overcome the barriers of whatever that is that the facility is seeing, that saying that, no, we can't accept them. Is it because they've been in other facilities and they were really difficult, or that, or it didn't work? And sometimes it's the family that's the barrier because the end of the day, like, the family makes it too hard on the facility, and they're very demanding and very, not realistic in their expectations of long-term care. And so sometimes when facilities don't want to deal with all that comes with that family, with their resident, their family, they'll also say no. So be careful in the ways that you present your loved one to a long-term care facility. And sometimes you can be overzealous because they have the right to say no before they enter the facility. It's very hard to discharge them once they're there. And we also fight to prevent them from discharging them. We dispute their discharges. But a facility for any reason can say, no, I don't think we don't want to take that on. So be very careful in the way that you interact with the facilities when you're attempting to put someone into long-term care. Don't be too overbearing. Don't call them 10 times a day, that sort of thing, because they'll say, and just being transparent, the facility will go, if they're acting like this and they're not even here yet, I can only imagine what this will be like when that person comes. And so you don't want to be the reason why they're not as favorable on your loved one going into care, but also making sure that those other barriers are taken care of that are preventing them from being able to go to a facility.
All right, thank you for all the insight you've been offering through all the different questions that we've had. We kind of had really a range of different questions, but we just wanted to close it off and say, do you have any closing remarks that you might want to make?
I just want to thank you guys for the opportunity, and thank you for your interest in long-term care. It's very tough getting people to see us and hear us. And like I said, I don't mind being that big, loud voice for those in long-term care. I'm perfectly okay with that. But we want, one of our biggest barriers is that people just don't know that we're here. They don't know that they can call us. They don't know that there is an ombudsman who's available that will go inside the facility and fight for my loved one. And we just want people to know that we're here. Whatever it is, I don't care how big or how small it is, if it's affecting that individual on a regular basis in long-term care, we're there to assist them, to look out for them, and to make sure that they feel supported and cared for. And so I just want to, like I said, I appreciate you guys for helping us get the word out and understanding residents' rights in long-term care, and that the ombudsman are here to serve.
All right, well, we are coming up at the end of our time here. I want to take a quick moment to thank our co-sponsors for today's event, the Office of Public Health Practice and the Institute for Human Rights. Webinars like this would not be possible without your partnership and support. So to our audience members, if you would like to see Sarah and Allah's final product with the Health Policy Ambassadors Program, be sure to follow us on social media at UAB LHC. That is Twitter, Facebook, and Instagram. And for any UAB students in the audience who are interested in applying to that program, applications will open on April 18th. More information about the program can be found on our website at uab.edu/Lister Hill Center. And finally, I want to thank you, Ms. Head, for all of the amazing work that you do. And I really appreciate you taking the time out of your day to have this conversation and answer these questions and get the word out about the Ombudsman program. So thank you.
Thank you, guys.